Okay, picture this. You're deep asleep, maybe dreaming, totally out of it, and then bam, your calf muscle just seizes up.
Oh, that sudden intense pain. It really jolts you awake.
Exactly. You're suddenly wide awake, maybe hopping around wondering, what on earth just happened? It's that awful middle of the night leg cramp.
It's incredibly common, isn't it? So
Yeah.
many people experience that, and for some, it's like a regular thing. Really messes with their sleep.
And that's exactly what we're diving into today. These nocturnal leg cramps, or NLCs, sound simple, but it turns out it's surprisingly
It
complex.
really is.
Our guide for this is a great new article from Professor Lin's Health and Wellness website. It just came out this July, called Calf Cramps, Medication Links and Treatment.
Yeah, and Professor Lin's whole focus is like cutting through the noise.
Mm.
Helping people look at health info critically, avoid the misinformation that's everywhere.
Which is perfect for us. So our mission today: understand what science actually says about NLCs, challenge some common ideas, look at treatments.
And do it without making everyone feel like they need a medical degree.
Exactly. It's all about thinking critically about health stuff you find online or hear about. This is a perfect case study for that.
Mm-hmm.
So let's start with where this specific article even came from. Professor Lin was prompted by a reader, right?
That's right. A reader named Kwok Tai Choi, 69 years old. He'd read an earlier piece about celery juice, potentially helping with NLCs, and he wrote in.
Okay.
And he shared his own situation. He gets frequent night cramps, and he takes a specific blood pressure medication, amlodipine, 10 milligrams. He was basically asking for a medical perspective on whether there's a connection.
Ah, I see. So his question really sparked this deeper dive.
It really did. It's such a perfect example of, where personal experience meets the need for actual scientific answers.
Yeah.
It shows why we need to dig deeper than just like personal stories or quick assumptions.
Absolutely. And one of the first places people's minds go, like clock ties, is, could this be linked to something else I have, like high blood pressure? It feels like it could be connected.
That's a very common thought. And when you look into the medical research, well, it gets a bit murky.
Murky how?
Some studies, especially older ones, do mention a possible association between NLCs and things like high blood pressure. But a 2017 paper specifically said the overall evidence for a link is not strong.
Not strong. Okay.
Yeah, and it gets even more complex. That paper talked about unadjusted models. These showed a connection between high blood pressure and more frequent NLCs.
Okay, hang on. Unadjusted models. What does that mean for, regular people trying to understand this? Is that reliable?
That's a really key question for thinking critically. Basically, an unadjusted model is like a first look. It shows if two things seem to happen together, but doesn't account for other things that might be influencing both.
Ah, okay. So like maybe older people are more likely to have both high blood pressure and leg cramps, but one doesn't necessarily cause the other?
Exactly. That's the kind of bias these unadjusted models are prone to.
Mm-hmm.
It shows a correlation, a potential link, but it doesn't prove causation. It's just a hint, not the whole story. You need more sophisticated analysis to filter out those other factors.
That makes sense. So it's easy to jump to conclusions if you only see that initial link.
Very easy.
So if the link to high blood pressure is complex and maybe not that strong, what do we know about why NLCs happen? Is it just a big question mark for most people?
Honestly, for many people, it kind of is. A big review back in 2016 found, and I quote, a large number of potential etiologies, lots of possible causes.
Right.
But the review also pointed out a big problem. Studies often define cramps differently, vaguely even, and lots of common health conditions might just show up alongside cramps because, well, they're common.
So it's hard to tell if they're truly connected or just happen to be there at the same time.
Precisely. Which leads us to a more recent paper from 2022. It stated pretty clearly that most nocturnal leg cramps are idiopathic.
Idiopathic, meaning we don't know the cause.
Exactly. Unknown cause. For the majority of people experiencing these cramps, there isn't one specific underlying disease or condition that's clearly responsible.
So doctors usually don't need to run a million tests unless something in your history flags a specific concern.
Generally, yes. Unless the patient's story or an exam points towards something specific, often no further deep investigation is needed. It kind of highlights how even common problems can be complex, and sometimes the focus shifts from finding the why to just managing the what.
Okay, that's actually quite reassuring in a way. Stops you chasing ghosts. Let's shift then to the medication Kwok-Tai mentioned, amlodipine, common blood pressure drug. Is that linked to leg cramps? What's the deal there?
Right. This is another great example of needing that critical lens. Amlodipine is suspected. Definitely. People talk about it. But the hard scientific evidence, linking it specifically to NLCs,
Yeah.
it's nuanced.
Nuanced how? What does the research say?
Well, there was an older paper in 1998 that looked at neuromuscular issues, possibly linked to amlodipine. But crucially, it didn't specifically list nocturnal leg cramps among those issues.
Okay, so the formal study didn't call out NLCs directly, just sort of general muscle nerve type problems.
Correct. But then you go online.
Ah, the anecdotes.
Exactly. Professor Lin's article points to online comments from 2014-2022, people explicitly saying things like muscle cramp with amlodipine or that their blood pressure med caused terrible leg cramps, real experiences people are having.
And what about official drug information? Does it list cramps as a side effect?
It does. A medical info site, SingleCare, noted in 2022 that muscle pain and cramps can be a side effect, but they estimated affects less than 2% of users.
Less than 2%. So not super common according to that source, but acknowledged.
Right, so you have this mix. Older formal research mentioning related issues, but not NLCs specifically, strong anecdotal reports from users, and official info listing it as a relatively uncommon side effect.
So faced with that jumble of information, what's Professor Lin's advice? If you're taking amlodipine and getting cramps, what should you do?
Professor Lin takes a very practical approach here. Given this mixed picture, the advice is clear. If you are experiencing NLCs and you suspect amlodipine might be involved, it's definitely worth talking to your doctor.
Ask about alternatives, maybe.
Exactly. Discuss alternative blood pressure medications. It really shows how you have to weigh everything, the science, the anecdotes, your own experience, and then bring it to a medical professional to make an informed decision for you.
That makes total sense. Okay, so beyond figuring out causes or medication links, let's talk practicalities. What can you actually do when a cramp hits? Or even better, to stop them happening so often?
Good question. There are definitely things you can do. Professor Lin outlined some solid evidence-based strategies for immediate relief right when the cramp hits.
Yeah, what do you do then?
You need to stretch that calf muscle. The best way is to actively pull your toes up towards your knee. Really flex your foot upwards.
Okay, point toes towards the shin.
Yes. And if it's hard to reach or get enough leverage, grab a towel, loop it around the ball of your foot, and gently pull back on the towel. That helps deepen the stretch.
Got it. A towel assist. And for prevention, to make them less likely to happen night after night.
Prevention involves consistency. Simple daily stretching, just a few minutes, can make a difference. And gentle exercise, think walking, maybe some stationary jogging helps strengthen those calf muscles. Stronger muscles are less prone to cramping.
Simple, but probably effective if you stick with it.
Exactly. And then there's something, well, quite new and potentially exciting on the horizon.
Oh, what's that?
Vitamin K2. A very recent study just published in May 2025 in JAMA.
Jamie, okay, that's a major journal.
It is. The study suggested that taking 180 micrograms of vitamin K2 daily led to significant reductions in how often people got NLCs, how intense they were, and how long they lasted.
Wow, vitamin K2, that sounds pretty big. Is that like the new go-to recommendation now?
No. Well, this is where that critical thinking comes back in big time. It's definitely promising, very interesting research, but, and this is Professor Lin's crucial point, it's new.
Right.
As of July 2025, when the article is written, no major medical institutions had jumped on board to widely recommend vitamin K2 for NLCs yet.
Ah, okay. So it needs more research, more validation before it becomes standard advice.
Precisely. Science moves forward, which is great, but there's a process. New findings, even exciting ones like this, need to be replicated and evaluated thoroughly before they change widespread medical practice. It's a reminder to be hopeful about new developments, but also patient and critical.
That's a really important distinction. Okay, so let's try and wrap this up for everyone listening. What are the main takeaways here?
I think the biggest thing is that nocturnal leg cramps, while common, are definitely more complex than you might think. Often they're idiopathic, no single clear cause.
Yeah, and that it's really important to look closely at connections people make, like between cramps and blood pressure, or specific drugs like amlodipine. The evidence isn't always straightforward.
Exactly. You need to understand where the information comes from. Is it an anecdote? Is it preliminary research using those unadjusted models? Or is it stronger, more established evidence?
It all comes back to that critical thinking Professor Lin emphasizes. We hope this dive has given you, the listener, a better toolkit for looking at any health information you come across.
Definitely. Being able to assess claims critically is just so vital today, especially for your own health.
So here's a final thought to leave you with. NLCs are super common, they really impact quality of life, yet there's still so much we're figuring out causes, the exact role of medications, even promising new treatments like vitamin K2 that aren't fully established yet.
Hmm.
What does that tell us about how much we still have to learn, even about conditions that affect millions of people every day? It really underscores why ongoing, careful scientific research is just so incredibly important, doesn't it?
It really does. Lots to think